Welcome everyone. This video contains a snapshot of our achievements and challenges we faced in 2017-18. We are made up of GPs and other healthcare professionals who know your needs and how to meet them. On your behalf, we plan, buy and monitor local health services, such as hospitals and community services.
So, where was local NHS money spent in 2017-18? As you can see, over half of our spend was used to pay for hospital care and ambulance services. Over £30 million on medication, just over £23 million on local GP services, £20 million on district nursing, health visitors, therapists and some specialist services, more than £19 million on supporting people who need help with their mental health, over £16 million to support people with continuing healthcare needs, £3.9 million on our running costs, £1.9 million on out-of-hours services and NHS 111, and a further £1.2 million on other services such as costs linked to fertility treatment and diabetes care.
We know we are stronger together, and this is crucial for the development of health and social care services in Castle Point and Rochford. We work closely with our partners, always ensuring that we break down barriers to deliver the best quality care for our patients.
People's lives are complicated. People's health is affected by all sorts of things, and it's just not possible to, to put them into a neat box and say that this provider can deal with this or that the county council can deal with that. So, what partnership working really is all about is about recognising that people's lives are complicated, recognise that they do need to work with various different organisations and professionals, and by working together in partnership we can bring those resources together so that we're better able to give a better service and better outcomes for people.
In 2017-18, we worked closer with Southend CCG and developed a shared vision across South East Essex. Having spoken with local people and community representatives, they've told us that services need to be more joined up.
I think it goes without saying that the very best people to help design and create the NHS services in this area are those people who use them. We're really fortunate in Castle Point and Rochford that we have a fantastic patient participation group, and this is made up of local people, local faith groups, people representing their own GP practices, people representing the voluntary services, who are really engaged in our community and really want the services to be the best they can be.
There are significant challenges that mean that we can't stand still. People are living longer than ever with complex long-term conditions like diabetes and dementia. Nationally, there is a 21% predicted growth in the number of people over the age of 65. £7 out of every £10 spent on health and care services is spent on long-term conditions. To tackle these challenges, we have been working with local partners to shape a new approach to community health and care across South East Essex, i.e. the care and support that is available outside of a hospital building. We want to create local systems of care that we refer to as localities, based around the needs and locations of people rather than boundaries of organisations. We want to bring together all of the resources in the community, provided by NHS, social care, community and voluntary groups, with a focus on prevention and joining up services, aiming to reduce distressing trips to hospital at the point of crisis.
We realise that all of this simply won't become possible unless we have the workforce in the right numbers, skills and values to deliver it. We're working with partners to make the local area an attractive place to live and work in. Word is spreading that we are starting to offer something different, which is more appealing to staff. In fact, if you know someone who would like to get involved in working in local health and care, do let us know.
In 2017-18, we have continued in our mission to extend the range of local services. We've invested over £1 million in a new community service called Swift to further support people who might need an extra helping hand to stay in their own home rather than going to hospital.
One of the most important things for me about Swift is that it's not about not admitting patients who need to be in hospital, but it's about actually supporting GPs to keep patients at home who are okay and we're comfortable to keep them at home.
We need to look at what technology can bring to the NHS to improve our health and make our lives easier. 2017-18 saw the introduction of technology solutions such as new mobile ECGs in GP practices, an app to support people with COPD, a range of videos to help individuals manage their long-term conditions, and technology to make counselling appointments as easy as possible. Part of the plan includes giving people more choice of health professionals. Experienced nurses, pharmacists, emergency care practitioners and social workers will help to create more time for GP consultations. A key priority for the CCG is supporting local GP practices who are witnessing firsthand the rise in demand for care. It is vital that we make GP services in Castle Point and Rochford sustainable for future generations.
What I do is I work very closely with the duty doctor for the day. All the home visits come in the morning. My hours are 10 till 6, so I come in at 10 o'clock. We look at all the different home visits, we allocate them. I usually take a fair few, the lion's share, normally about 10 to 12 or even 13 visits, and I pop out and I see everybody. It saves a lot of time for the GP, a lot of time for them, because they can see generally about 6 patients an hour in clinic, but then for a home visit it takes up about a whole hour. So obviously frees up a lot more visits for patients.
GP partnerships are offering appointments at evenings, weekends and on bank holidays. However, there will always be times when patients will need to visit a hospital to receive emergency or specialist care. A big part of 2017-18 was about the reconfiguration of local hospital services, which included a public consultation across Mid and South Essex. We would like to thank everyone who took part in this consultation, and we are committed to working with our partners to identify how we can offer local people the best hospital care for their condition.
Our vision is simple: to help improve the health and lives of people in South East Essex, now and in the future. Through developing our localities in a joined-up system of care, we will help to improve the care and support available in the community based on local people's needs. We can't do it alone though. Together, we can help you live as healthy a life as possible. Thank you for taking the time to watch this video. I hope you agree that it's clear to see that a huge amount of work has been done by our hardworking staff and partners during 2017-18. There's always more that we can do, but we will always continue to strive to work hard for our patients and local community.